Yes.
Mr. Biddy. Not Mr. Biddy. So, in the urinary system, the bladder is normally lower in the pelvic area than in the mince. And the urethra, needless to say, this is your urethra. Make sure you remember the position of these. And I'm going to give you a diagram next week. I'm bringing you a diagram of this week. And just so that you will study it for the test, okay, in case you get it. So this is around 1/5 in guys. For women, it's like our urethra is this long, little tiny thing. So when they insert a catheter, a urinary catheter, it's just that much. But for guys, it's the whole way, the whole 5-6 inches. So that hurts quite a bit. Okay, that hurts quite a bit. So I want you to remember that the ureter, which sounds similar to uterus, right, is the one in the top. So the kidneys function as regulators, and they also filter. And this is where we develop stones too. There's some people who are more prone to stones than others. And most of the time, people who are prone to stones is people who drink a lot of Coke, a lot of fake stuff, and not enough water. Fake stuff, all the fake stuff. Well, Coke and all these drinks, that kind of stuff. Oh, like this drink here. Perla is hiding her drink now.
I don't drink that often.
This is your reprieve here doing this.
Today is my treat.
Today's your day. Today's your day. So like let's say like Coke and stuff. If you look in the back, it doesn't have water. It's only chemicals together. And you also, sorry, Perla, you also can use like things like Coke and Sprite and Pepsi, all these, actually to clean a car inside the motor of a car.
Which I do. My battery is always.
Mountain Dew, very good. Yeah. And so all these, if you have like a piece of metal that is stuck, there's two pieces of metal, like a knob or something like this that is stuck. If you just put a few drops of this, let it sit there for a little while, it loosens right up. Yeah, the toilet, to clean the toilets. It gets rid of all the soap, the stuff, all the dirt, all that. The toilet's also really good for that. And so, because it has so many chemicals. And when we do digestive system, which will be next week, we'll talk about why is it that our stomach's so strong. So I want you to remember the position of these, and I will give you a diagram next week so you'll have it and study it. So this is the ureter. So if you have stones, the stones have to travel from here all the way down into your bladder. The pain is really bad up here. So most of us, people, I know that in my culture group, everybody says, oh, my kidneys are hurting, and they go like here. Oh, my kidneys are hurting. Your kidneys are not there. That's your butt. The kidneys are not here. Your kidneys are up here. All the way up here. Almost by the back of the lungs. Okay? They're really high up. So when somebody comes in with severe upper pain, like almost from the breast up here, usually is your kidneys are acting up. You may have a kidney infection, or you're trying to pass a stone. So the stones try to come down this little pipe. As you can see, it starts big. So you get a little pain, not too bad, not too bad. Guess what? Now the stone is stuck. It's trying to come down. It's too big. So it gets stuck in there. So this is when we have to put stents. This is another place that we can use stents to open up the uterus. And the ureters, we can open up like that with a stent just to give it a little more room to see if we can pass the stone. Otherwise, you need surgery. If the stones stay up here, and there are many, many stones, then we can do laser and try to blast them, or ultrasound to try to blast the stones away. We usually, with the ultrasound, because we're blasting them, it's like an explosion. If we do high frequency and the stones, because they're like regular stones, they break apart. Then what we do is we put you to sleep so you don't feel that. But when you wake up, you're going to be so sore. very painful, very sore when you wake up. So the urethra, the one with the A, is always in the bottom. Don't forget that one. So if you get a diagram like this, I'm going to give you one next week. I'm going to make sure that that you have it, so you won't forget it.
Martha?
Yep.
I'm not sure if I missed the email. I do apologize if not. Will you send us the ones from last Saturday?
No, I didn't send them. My little friend here reminded me. One of them reminded me. He reminded me that I forgot to send them. But I will. I was going to send the notes. The notes is what I had talked about sending. And I am going to give you more. I do need another diagram.
The slides you showed us last week? That's what you meant?
Yeah, those are the ones that I forgot to send. Yes. Because of course I left the address someplace else. So again, this is why women get more frequent urinary infections. It's really important for us to learn to teach our daughters and our girls to clean themselves properly, to clean from the front to the back. And the reason why we do from the front to the back, guys, front to the back is because we want to make sure that if you do it backwards, you bring the bacteria from your rectal area into the front, which is loaded, billions of bacteria into your bladder. So it's very important to clean from the front to the back and get rid of that paper, and front to the back, get rid of that paper. If you use the same paper back and forth, and little kids, I see, my grandkids, they're like, the paper goes back and forth, it's like, that's it, and it's like, no, you have to teach them, because otherwise they don't know better. And God knows what they do at daycare, but, it's like.
Also seniors that over 80, also females.
Oh, yeah. And Perla was saying older women get a lot of urinary tract infections also. Also the same, they're not able to, hygiene is not easy anymore to be, a lot of times they have a hard time just holding on in the bathroom and stuff like that, so they may not be as careful washing, or they may be afraid to take a bath by themselves. They may have to wait maybe till a son or daughter show up, maybe once a week, twice a week. So to help them, sometimes they don't have help at all. Or they may wear diapers. Diapers are horrible because when the seniors have to wear the diapers, for women, it's hard. They get infections all the time because the urine just sits there. It's just like a little kid. But because their immune system's so poor already, and from being older, that they get a lot of infections in the urinary tract, in the urethra.
Would you mind going back a moment?
No problem.
So, did you say, so the urethra in the woman is much shorter
Yes,
than
it's
the
just
man?
this little.
And did you say that that's why they get more infections?
Yes.
But why?
Because for guys, for the bacteria, let's say the bacteria gets to the tip of your penis, right? By the time it travels all the way down, it dies. So it doesn't get down to the bladder easily, compared to us, that ours is really tiny.
Oh, okay.
So it's so short that the bacteria is alive and well still, and it gets into the
Yeah,
bladder.
yeah.
That's why.
What does that mean, uterus rests in the bladder?
The uterus sits on
Oh.
top of the bladder.
Right.
That's why you
That's why we women urinate more often than men. That's why you guys can go at a whole concert and don't go pee. And we go 4 times. I go 5. No, I go 4 times. And it's because as we get older, also our muscles, for women, our muscles relax. If we had babies, all our muscles relax. And as we get older, face, breast, everything, pelvic area, everything relaxes. So as it relaxes, it also puts more weight in the bladder. And the bladder becomes weaker, so you have to pee more often. And the lack of also estrogen also affects it too. Sometimes when women have problems holding to the urine, we ask them, we give them a little, the cream, the Premarin cream, a little estrogen, and to help them with the bladder also. So the kidneys are two reddish brown organs in the back of the abdominal cavity. So it's right up here, right behind the stomach. Their main function is to regulate the amount of water in the body, as well as to keep the body's fluid at a constant concentration in acid-base levels. This is an essential job. So in order for, if your kidneys malfunction, these little tiny things, they're around this big, they're not very big at all. If these malfunction, what you need is dialysis. The dialysis machine is as big as this, from here down, and this wide. One of the tubes from your arm takes the blood out and filters it through this machine. The machine cleans it out, and then through the other end, the blood goes back in. This process takes 5 to 6 hours. They have to have this done 3 times a week. If they skip one day, they'll end up in the hospital because all the toxic chemicals stay in your body. So you become exhausted, you start swelling up, you feel very sick, you feel nauseous, you may start vomiting, you may not make a lot of sense because you're out of it because of all the toxic stuff in your body. So when the main job of these organs is to remove waste product from the body. So this is why we're able to test urine whenever we want to do drug tests or see if you're taking enough medicine or certain medicine. We can do a urine test and we can see it in there because your kidneys filter everything through there. So that's the evidence right in there. So that's why it comes out through the urine. So we can see it. We can live with just one kidney, but we cannot live without proper kidney function. Our body will become toxic and we will die. Most people on dialysis is really hard because the day that they get dialysis, they're so exhausted. Just imagine 6 hours in a machine. The machine takes out all the toxins, but at the same time takes out all the good stuff too. The machine's not able to tell what is good and what is bad. So it just cleans everything out. So it leaves your body with nothing. And so you start feeling really tired and really bad when you get your dialysis. The next day you feel wonderful. You feel excellent. The next day or the next morning, you start feeling down again because now the toxins are building up again. So you're due to get dialysis again. So you really have like maybe 2 to 3 days a week maybe that you feel okay. So it's pretty sad because you're hooked to this machine, and life is really pretty much this machine.
Dialysis is forever?
In some cases, forever. Most people cannot live in dialysis for too long. People can live up to 15 years in dialysis, sometimes a little bit longer, but usually they don't live longer than that. The body, the places where we can put the fistulas, we do the blood. In order to do dialysis, we need to get one of your veins, one of your arteries, larger, because we're pumping all the blood out of your body and putting it through this machine and putting it back in the other way. So the amount of blood is, in order to do it in 5 to 6 hours, it needs to be done fairly quickly. That's very quick. So what we do is we go inside and get one of the arteries in your arm, usually it's in your arm, and we put something in it like a fine, like a tubing. And this thing is going to get bigger and bigger as the weeks go by. It has to get this thick. This is why you may see people on dialysis that their arms have all these lumps in it. They look really, really weird. Most people cover themselves, but they have these twisted veins, they're like this thick, and that's the fistula. We call it a fistula. So we make this inside. We reconnect some things in there to make this fistula. So we're able to pump things out and in just as quickly.
You took out the blood.
In order to take out all the blood. All the blood gets taken, not at the same time, of course, because you'll die. So